Hi, Rick Tharp here with RX Kinetics with another APK program demonstration. In this installment, we'll go over how to add a new patient and how to perform prospective dosing with a population model. So we'll begin by logging in with our initials, clicking the Accept Disclaimer button, and we'll come to the Patient Data tab. To add a new patient, you click on the little plus symbol up there, which is your add icon, and you notice when you do that, the status changes to adding patient, and all the other program functions are dithered out, and they'll stay that way until you either cancel or save. The first field is the patient name, and then it has to be in a specific format, and it's last name, comma, first name. Let's tab to the next field, which is medrec number. Tab to the next field, which is location. That would be, for example, a room number. The next field is consult, and this is a checkbox, yes or no. You would select it if it was a consult. In other words, you were requested to consult on this patient. Uncheck it if it's an intervention. Let's assume we were requested to consult on this patient. The next field is the physician input, and you can either free text in a name, or you can click on the physician lookup and view a list of physicians who are in the database. You can select and then copy. While you're here, you can also add physicians to the list. Let's copy Bill Jones. You'll see it shows back in the attending physician box, and we can go on to our next field, which is age. Next is the age units, and if it's a peds patient, you can enter age in months or days. Next field is height, and it's in centimeters. If your hospital is not metric, that's not a problem. Just right-click on that box, and it'll pop up with an input, so you can input height in inches. And when you click OK, it'll automatically convert it to centimeters. The next field is weight in kilograms. Then we select gender, and then enter our serum creatinine. One more double check of the data. If that looks good, then click the save icon up here. And you'll notice when you do that, the status changes to browsing, and our icons become active again. You'll notice on anthropometrics, the lean body weight and body surface area were calculated for you. And in creatinine clearance, you can select between these methods, which is Cockcroft-Gault adjusted body weight or Jealous multi-step method. If you click other, it also pops up with you some, it also displays some additional creatinine clearance methods you can choose from. Cockcroft-Gault lean body weight, total body weight normalized, Gelflo's 73 equation, or the MDRD equation, or Salazar and Cochrane. Let's say we like Gelflo's 73 equation. We're going to use that. You'll notice that they copied over to that box and selected. We're going to do a prospective dose based on the population model, so we're going to click here, bring up the prospective tab. You'll notice the select drug drop-down box is active. Click here, and you'll see a list of the available models. We're going to do vancomycin for this patient. There are two vancomycin models that ship with the program, differentiated here by CL and KEL. CL is based on Winter's latest published model, and it's a good one to choose, the majority of patients. Well, after you choose your model, you'll notice the inputs here are populated. Those are pulled up from the database. You could edit those, the target peak, the time after infusion that peak is targeted. You can change the target trough if you wish, dosing weight, volume distribution in liters per kilo, infusion rate. Say you infuse it over 60 minutes instead of 120. And here's your model parameters that are used to calculate clearance. If we're satisfied with those numbers, we can click Calculate. I do want to mention that these model parameters and the targets, those are all pulled from the model database. So if you're finding yourself changing this all the time, you can just go into the model database and change it. And that way, every time you pull up that model, it'll populate this frame correctly. That's one of the advantages of the APK program, is the models are not hard-coded in. They're in a database. It's open. You can edit those. If we're satisfied with the parameters, click Calculate. You'll notice here in the ideal dose is displayed and the PK parameters are calculated, displayed for you. It's recommending 1352 Q12 let's enter a practical dose. When we do that and it's acceptable dose, you'll see the estimated peak and trough are displayed here. You'll also notice that the icons up here become active. And click on the View Graph icon here to view a graph of the serum level, and you'll see it shows your approach to steady state. You're starting out at 0, and after third or fourth dose, you've reached a steady state. Now, if you want that graph printed on your consult form, click Save here. And that's the next thing I wanted to talk about, was printing the consult. Now, it's important to print the consult because that's the trigger to save that consult. It's important that you save a record of what you've done. And the only way the program knows that you've finalized your recommendation is if you choose to print it. And you don't have to print a hard copy. You can just view the print preview. But when you do that, your consult is saved. This is the print consult dialog. The first thing that at the top here is the consult header. And the program automatically adds the drug name to the beginning of that. So the header of our consult report is going to read vancomycin pharmacokinetic consult. You may want it to read vancomycin dosing recommendation or what have you. This next area is for some canned comments. For example, if you picked half-life within normal limits, VD within normal limits, that's going to show up in an area called the assessment on the consult form. We'll show that here in a minute. You can also print some canned comments here: follow-up levels at steady state, monitor serum creatinine twice weekly, clinical pharmacist on call 24/7, or you could even free text a comment here. Let's say measure random level after the 5th dose. When we're satisfied with those things we want to see on the consult, click Print, and it'll show a print preview of the consult. You'll notice the graph is in full color, and it'll print out in color if you have a color printer. Well, let's zoom in on that. And you can see what the consult looks like. Let's limit down a little bit. There we go. We have our patient data section, calculated data section, the dosage recommendations. This is where those comments appear that we talked about. The graph shows at the bottom. It's a very professional looking report, something that you can put on the chart. When you're done, you can click Close. And you'll notice that when you click the View Previous Consults icon, that that consult we just performed is now saved. You could also print a monitoring form. And this is it's a form that you can use to keep a daily record of vitals if you're monitoring that patient. There's an overview of how to enter a new patient and how to perform prospective dosing with the APK program.